we invite Dr. Parihar, who was busy in a trauma session, to give us an atraumatic talk.
Thank you, sir. Can't expect atraumatic from a military person. Either there will be prevention of trauma or full of trauma, sir. Thank you, sir. Thank you very much. Dr. Samar Basak, Honorable President of AIOS, Dr. Muscati, Honorable former President of AIOS, Dr. Sujata and Dr. Namrata, two great pillars of strength for Indian ophthalmology and for me too. My dear friends, and I acknowledge full contribution of Ms. Rakhi in making this presentation. If anything is good, goes to her, anything bad goes to me. Thank you, Rakhi, for helping me as usual. So, what about the knowledge? Knowledge sharing is knowledge gain in any field of life. So here in the global scenario, what are the possibilities we have to explore to learn and to provide learning? The cross-cultural learning, collaborating with eye banks worldwide allows us to learn from diverse practices, experiences and challenges. Knowledge sharing helps us adopt best practices and avoid pitfalls. Innovations, very important. By sharing research findings, technological advancement and clinical insight, we collectively drive innovation in eye banking. New techniques, preservation methods, and quality assurance protocols emerge from this exchange. Indeed, no innovation, no research is of use unless until it is translated into the benefit of society and benefit of the patients and human beings. Most important task is the capacity building at each and every sphere of functional zone, and knowledge sharing enhances the skills and expertise of eye bank professionals. Training programs, workshops and conferences facilitate continuous learning. Our predecessors, they have worked hard to see that eye bank goes at the global level to improve the training facilities, improve the infrastructure, and with due respect, I acknowledge each and every office bearer of Eye Bank Association of India since its foundation for their contribution. When we talk about the collaborative efforts to address common challenges, is a tissue challenge, tissue shortage, quality assurance, and ethical practices. Three very important aspects. Many countries face a shortage of corneal tissue for transplantation. Collaborative efforts can help optimize donor recruitment, improve preservation techniques, and ensure equitable distribution. When we have our own issues with the going to the global level to help, first of all, we have to see that in our own interest state, how we can reform this system and tissue storage is augmented and enhanced in quality and quantity. Quality assurance is very, very important, and quality assurance of tissue, quality assurance of eye bank, quality assurance for the technicians and ophthalmologists. You need to standardize protocols and sharing quality control measures, enhance the safety and efficacy of corneal transplant. Collaborative networks can monitor outcomes and identify areas for improvement. And for me, this is my KRA to ensure that we develop a system which is having a proper quality assurance. We have been, sir, Dr. Basak and Muscati, we have been working on to how to get standardized our eye banks and eye bank technicians. Last Sunday, I was with the National Academy for their leadership development program as a chairman, and NABH chairman, Dr. Mahesh Verma, was there with me almost 2 hours. I discussed with him, and he has readily agreed to help us and assured us that we make a guideline for both the issues, and they will evaluate and make it a NABH accreditation process. I just wanted to share with this audience.
Good, it would be an incentive for pushing our eye banks to get NABH certified in the absence of any internal criteria that we have. I don't know how many eye banks will, we'll have to handhold them in the process. You cannot tell them to have NABH. Nobody will do it. We'll have to handhold them.
Yeah,
and
but before
push
that
them to
we
improve
have
standards.
to make a,
Internal, we have to do that. Yeah.
and we'll
Before
make
it
a,
goes to NABH.
yes sir, we'll make a, our committee
SOP.
with the higher esteemed people and guidance, then
Agreed.
we'll recommend and goes. I thought it is appropriate to
Yeah, put it there.
inform the audience here.
Just one comment here, that
sir.
If for an institutional eye bank, the NABH is coming for accreditation, they includes their eye bank also. Recently it happens with us. So our eye bank is accredited by the NABH for as a whole.
Because the
NI.
But there are certain standalone eye banks also.
That is
So,
what they
because
only
when
this-
this question was raised here about some other department, they wanted to ask, can we have our department accredited? I said, no, it cannot be accredited because it is the part of the system. So we are doing the accreditation for the entire.
Yes, Dr.
this thing.
Shakeen.
Maybe if we have a multi-specialty hospital, like those have a labs, when we go in for inspection, for assessment for the NABH, we take it in a part of it. But when you go in for the lab, they have their own standards. Similarly, eye bank, if it's with the eye hospital, we assess it as a part of the hospital. So it's assessed as an eye bank into NABH accredited hospital. But we have to create our own standards for the, good standing of the eye bank itself.
Correct.
So
That's what Dr. Parihar is saying.
We can create, that would be a good, step towards standardization of the eye banking.
There is no harm to.
Absolutely
push
no
it.
harm. Absolutely no harm.
If it
All
comes
to the
through,
good.
if it comes through, it means really it will help
Yes.
not only to our eye banks but the technicians also, sir.
Yes,
Once
yes.
they are accredited, it means it will help them.
That will raise the standard all across India.
Everybody, yeah.
Uniformity and other aspects which
Okay.
is going to cover that.
No, we'll have a big, wide this thing on deliberations and discussions getting, and once it is made, we'll circulate it, pros and cons, and then we'll proceed. And we will study the other eye banks, international eye banks, their criteria, etc. So it will be a full-form document. Here comes the role of international organizations and partnerships with the EBA and GAIBA. I have very limited exposure with them. My predecessors probably would have had more. And EBA facilitates collaborations among eye banks globally. It provides resources, guidelines, and certification programs. So obviously, we will get the input from them also. Partnership with EBA enhance eye banking practices. Global Alliance of Eye Bank Association connects regional eye bank associations, fostering knowledge exchange and joint initiatives. It advocates for eye donation and transplantation on a global scale, and collaboration with medical societies is very important. In a present era, you can't function standalone. You have to be the part of the system, and partnership with ophthalmological societies, transplant organizations, and public health bodies strengthen the advocacy efforts and promote the eye health. What all challenges we are facing as usual: the shortage of donor corneas, improving donor screening and tissue processing technique. These are the major issues. Ensuring the safety and quality of donor corneas require rigorous screening protocols. Collaborative efforts can help standardize screening criteria and enhance tissue processing methods. These are added challenges. Timely distribution of corneal tissue. Probably in our country in last couple of years, there is a definite improvement in getting the tissues in time, but still some more needs to be carried out on these issues. Maintaining high quality of standards. This is very, very important, and still a lot of things has to be done on these issues because there is a wide variation in the qualities available with us. Trained staff and infrastructures. If you have a trained staff, it is in-house training. Very few institutions in our country are having a structured program to do the training of the eye bank technician. EBI has started the certification of the trained technicians with the aim that at least there is some efforts are from our side and giving some recognition to the staff, those who are getting it. Our future on this goal is to affiliate this, make a capsule for the training, affiliate it with some of the technical boards of the different states, and make it as at par with the other 2 years diploma courses. That would be our aim in future for the iBank technicians. Affordability of equipment and storage media is, again, equipments are very costly, and hence there has to be the collaborative efforts can explore cost-effective solutions and resource sharing. Inadequate public awareness has to be raised in future. Community outreach and hospital partnership, quality assurance, these are the other strategies and best practices we are intended to follow it. Research innovations, I have already mentioned. Training programs, we have discussed. Digital platform. Now things have become digital, and you are seeing the YouTube creator. They are making they are become the power more than the TV media. And in most of the Western world, the YouTube creators, they are influencing the national politics also, and in our country also this trend is being seen. So if you have to develop the more awareness, we have to get engaged more and more with the digital platform. Expansion of donor pool, technological advances, these are the future directions for us to take care of it. Capacity building, yes, everywhere it is required. Standardizations we have already discussed. What all opportunities for improvement and growth, infrastructure development and public awareness campaigns. So call for action for stake. Government agencies should allocate resources of funding support, because iBanking is very tough to sustain without any government supports, and with the NGOs, healthcare providers and NGOs and community have to come forward and help us. Thank you very much. And on behalf of EBI and organizing committee of next EBI CME, Dr. Sujata Das, I invite each and every one of you and propagate this message to attend the CME, that it will be our 14th annual CME in Bhubaneswar. Sujata, if I'm not wrong, these are 14th and 15th September?
Yes, 14,
Yes.
15.
Thank you very much.